Thank you, Seth. As Seth had said, I'm Elizabeth Seitz with CQL, and I'm going to be your opening act for our webinar today, Putting Organizational Data into Action. I'm really excited to introduce our headliners who have such great information to share, but I'm going to let them introduce themselves.
Hi, my name is Rick Brown, and I am the Executive Director for Community Ventures and Living. Glad to be here.
And my name's Tom Dukes, and I am the Director of Quality at CVL. It's our pleasure.
Thank you, Rick and Tom. So I will get us started. And what we want to do is we really wanted to start with talking about some key competencies when it comes to moving your organization to one that really thrives on data and using data to drive your decision making. So in order to move really to data-driven decision-making, there's four key competencies. Knowing what decisions need to be made, knowing what data is needed to make those decisions, ensuring the data that you have is accurate because you don't want to be making decisions on bad information. And then, of course, having the management framework to change organizational strategies and processes based on that data. So this really is about your systems and your practices around your quality management system. So what is often helpful is to start with what we call an organizational data assessment. Now we know the idea of data collection can sound and even be overwhelming, but data is just information. So start with this data assessment and ask yourselves the following questions. Number one, what data do you already collect? And within what data or information you already collect, think about your organizational demographics, because these can really help you understand the people that you support. Ask, why do you collect these types of data? Because you have to, because you want to, or maybe you don't even know why you collect certain types of data. How do you collect the information? Electronically, via paper? Who collects it, when, and how often? And of course, what do you currently do with it? So it's important to understand what you do. And if you're not doing anything with the data, you have to ask yourselves, is this really something that's important to us? So we're going to take a look at some examples of types of data that you might collect. Now, it is not an extensive list. It's just some examples. And I'm going to run through them actually pretty quickly because Rick and Tom are going to share some practical examples of information that they have collected and used within their organization. So you might, around the area of rights, collect information around rights assessments and discovery. Of course, POM data is going to be essential in all the areas that we talk about. So if you're ever struggling to understand or to identify what kind of data or information you are collecting in an area, go back to your POM data. And if you're collecting POM data, this is some great information in all the areas we're going to talk about. Of course, with rights, anything from your Human Rights Committee, and then, of course, any data around rights restrictions or interventions. When it comes to respect, dignity, and autonomy, all kinds of information around complaints and concerns, survey data, if you do any kind of surveys with people you support, your staff or families. You can look at the types of decision-making authority of the people you support, representative payee information, of course, POM data, and then employment. How many people you support are gainfully employed? With relationships, of course, POM data is important, along with potentially survey data that you might collect and volunteer information. How many people you support are doing any kind of volunteer work, or how many volunteers are coming to your organization and volunteering their time. Another data source could be anything around protection from abuse, neglect, mistreatment, exploitation. So what data could you look at? Well, incident management data is always a big one. And a lot of times that's required by regulation. any kind of assessment or training information, you know, thinking of how well do people that you support really understand abuse, neglect, mistreatment, and exploitation. And then, of course, POM data. And also, you know, you might look at allegations around abuse, neglect, the number or type or the amount that have been substantiated or unsubstantiated. With health, you might look at data around illnesses or hospitalizations. And of course, many organizations look at medication errors or any type of medication use. You might look at how many people that you support administer their own medications. And of course, POM data around best possible health or choose services. When it comes to safety, lots of information again here because safety is closely related to many of the areas of the basic assurances. But you could look at data from internal and external safety reviews and audits and what is being seen during those things. And again, any kind of incident management data also is a part of safety. And then POM data around you know, people are safe, people use their environments, anything looking at safety, how people are safe, are not safe, or if they feel safe. Around staff supports and development, there's always a ton of things that people can, data and information that organizations collect. So some things might include your staff turnover, of course, and that could be overall or by position. Hiring, what does that look like? Retention and vacancy information, absenteeism, overtime, and employee recognition. You might also look at training data, which kind of goes hand in hand with some of the survey data. So with surveys, you might do surveys like exit surveys or exit interviews, stay surveys, satisfaction surveys. You might also do training surveys just to learn how effective is the training and what are people getting out of it. And then, of course, POM data. Around positive behavior supports, you might look at data regarding psychotropic medication use, around physical interventions and or behavior support plans. More POM data that can be looked at to kind of understand how you're doing in this area. And then data regarding the number of people supported that are leading their own plan meetings, choosing their own goals and outcomes that are important to them. Very, very important information. In the area of financial management, which is our last area where we're looking at specific data, you might have data around expenditures, finances, organization-wide finances, or by program or department or service. You might also look at volunteer use, fundraising data, fundraising information, grant information, marketing and communications information, such as social media use by the organization. And then, of course, again, POM data. There's always some good POM data that can be looked at in this area as well. So just a little bit, different types of information, different types of data that you could look at. Again, certainly not an exhaustive list, just some simple ideas that can get you started if you're not there yet. So let's look at one example of taking one piece of that data and putting it into action. So let's just say that organization A wants to collect and analyze data on rights restrictions. Now, the first thing that you might do is figure out, okay, how are we going to identify all this? How are we going to identify all the rights restrictions or interventions that are placed on people? And you really want to make sure that you're getting all the information. So you might need to really go beyond just your rights committee minutes because a lot of times there happen to be things that aren't being reviewed. So you might visit people's homes or other locations to see what restrictions might be in place that aren't being reviewed by the rights committee. You might want to talk with people receiving services about practices that they feel are restricting their rights. Look at any kind of rights assessment or discovery tool results. What are you learning from those rights assessments? Look at people's plans, their support plans, person-centered plans, whatever that's titled, and any behavior support plans for potential restrictions that might be listed. And then you might want to keep a spreadsheet of all those. Everything that you found, you might do it by person. So then you can see and you can aggregate that to see the breadth of these across your organization. So you start with this by identifying all those things that are placed on people so that you can then, once you know all that, you can really start to understand, okay, what is it that we want to know about this information? We have it here. Now, what do we want to do with it? So one single piece of data, like restrictive and intrusive interventions, can be broken down and analyzed in many, many different ways. So with this information, particularly, you might determine that you want to look at how many restrictions are in place for each person, the total number of restrictions in place across your organization. You might look at it as the average amount of restrictions in place for people, the different types, the most common type, maybe the number and type of restrictions as it correlates to different demographics, such as age. Do people that are younger have less restrictions than people that are older, or is it the opposite? Do males versus females have more restrictions placed on them by disability or guardianship or living situation? This can be some very interesting information. You might look at how many restrictions maybe you're receiving due process versus those that you find haven't. How many restrictions have fade plans? And then how many blanket restrictions are in place? You might not realize that you have some policies or procedures that are in place that are really restrictive to everybody you support. And then how many people are subject to restrictions because of someone else and it's not applicable to them, yet it affects them as well. So just this one piece of information, you can ask so many questions. So you have to know, how do we want to, what do we want to know about that information? Because then you're going to identify your goal now that you have the information. So what is that goal now that you've collected all the information, you've organized it, you kind of know what you're doing with it. So your goal might be, number one, to ensure that all restrictions have received proper due process. It might be to eliminate all blanket restrictions. It might be to ensure that all staff are educated on what a rights restriction is. You might want to determine what people understand about their rights, or maybe it's just simply to reduce the number of restrictions overall. So there's a lot that you can, number one, gather for baseline information, decide how you're going to break it down, and then identify what your goal is. Now, the reason I brought up rights restrictions and that something that you might look at is because, well, with our example here, why is that information important? Because we want to know why we're collecting something. Well, if you look at this information, you know, CQL, this is from a lot of our POM data in our portal database, and we learned that there is an impact on rights on respect. When people are able to exercise their rights, the outcome for people are respected is present 74.2% of the time, compared to just 29.8% of the time when they're not exercising their rights. So looking at this is important because rights and respect have a clear impact on each other. And if our mission is about about rights and respect for people, then this is important data to understand and to know. So a data-driven organization is one that can analyze trends of the past, can successfully navigate the present, and can anticipate the future. So to do that, you want to create a plan regarding how your data is going to be collected and organized, like we just talked about. You're going to want to understand who will be responsible for collecting that information, analyzing it, and then developing action steps associated with that data and information. It's important that you set time frames for how often you're going to do that. The goals you set are achievable. Okay, don't get too lofty to start, set achievable goals. And importantly, how do you keep everyone accountable to maintain that momentum of these goals that you've identified are important for the organization? So if you want to make good decisions, you have to understand what others are seeing. So you really need to involve a variety of people in the analysis and the decision making. So also some things you're going to want to ask yourself, how will you know when you've achieved your goal or if the decision wasn't the right one? Because sometimes even with the best data, the right decision isn't made, and that's okay. So how are you going to know when you've achieved that goal or you need to shift gears? How are you going to communicate the information to everyone so everyone is in the know about what this information is telling you and what you're learning from it? And then most importantly, you always want to go back to your mission. Why is this important? And if it doesn't align with your mission and you can't answer the question of why this is important, you may need to reassess why you're looking at that piece of data or that information. So lastly, I really want to talk briefly about putting it all together. Now, like I said, I'm going to be brief because Tom and Rick are just going to share some specifics and some great information about how they do this within their organization. But I just want to set the stage for them. So think of your organization's data management system like the dashboard of a car. The dashboard of a car, its purpose is to show the driver all the different vehicle systems in one place. Okay? It lets the driver know what's happening everywhere and how everything is working together to ensure that the vehicle is working the way it should. So think of the vehicle as your organization. And this dashboard is your data dashboard that lets you see every part of that and what's happening, even when you can't see the gas tank, even when you can't see the engine, you can see it on your dashboard to see how it's running. So every piece of that car, every component is a different service or department within your organization. And so you need that system, you need that dashboard to know what's going on across all of those systems. Now, the system doesn't have to be fancy, but it needs to work for your organization. So it could be a very simple spreadsheet, or it could be something much more complex. The whole point of developing a centralized system is ensuring that it's a system that works for your organization, big or small, fancy, not fancy, electronic, whatever it may be. It has to work for your organization, but it should all be in one place. And I think a lot of times people don't realize really that we see and use data dashboards all the time without ever realizing it, from banking apps, a Fitbit, Apple Watch, exercise machines, credit dashboards, to many others that we use near daily. These are data dashboards of information. And so being able to see everything together lets you know how everything is affecting or impacting each other piece. So to start, and really this is just to sum it all up for Rick and Tom, but really start by analyzing what you already have. Okay. It will evolve if you want it to, and it should evolve as you evolve as an organization. But really start with what you have. And before you know it, really, data collection, monitoring, analysis, it just becomes part of what you do. Um, Automation and efficiency are great. Efficiency really is the key. Is it really worth it to try to pull data, but it takes you so long to pull that data? Maybe you're not ready for it yet. So don't spend a lot of time gathering data that really doesn't give you the information that you need or want. And, graphs are great, but you can be just as effective with a system that's easier to build or to use. So Yeah, these are just the great places to start. But really, what I'm going to do now is I'm going to turn it over to Rick and Tom, again from Community Ventures in Living, to really talk about their journey with data. So, Rick and Tom, I'm going to let you take it from here.
Thank you, Elizabeth. I appreciate that. And I think you're right. When I just think about our journey, it has been an evolving journey, right? And we're still evolving as we go. So what I hope to share with you today is just talk about, overview of who we are, and because I think it's going to help to put in context with regards to what the organization is, and then a bit about our journey through using data, and it is an evolving journey, and that's kind of moved us into using some tools that will show you. Now, the tools are a bit complex, and so as I go through here, please understand just in terms of a slideshow, it's a little hard to kind of see those well, but we'll go through that. And then I'm going to turn things over to the real expert, which is Tom, who is going to say this is how we use those to actually make outcomes happen. So Community Ventures, we're in Indiana, and briefly, our mission is to assist people and support persons who are developmentally disabled, as well as their families, to establish and or maintain homes that are truly their own. And what that really means is about the next slide is that we have about 350 people that we're supporting across Indiana. And we help them maintain homes. We don't own any agency homes. All of them, they're just community homes, just trying to help them get there. And as you might imagine, we are accredited by CQL. So during our accreditation visits, we've talked about, actually for years, we've been talking about trying to do more with data. And really where we began is where a lot of folks began is we just started collecting service exceptions. Some of them are driven, as Elizabeth mentioned, some of those are state required. And so there's reporting requirements that we had. We started collecting those. And then we began adding our own internal initiatives saying, hey, we need to keep data about these things. But honestly, it was more statistics. But in detailed analysis, honestly, it was just really, really tough to get to. It was difficult to really figure out from our data what elements were important to keep at our fingertips. And I mean, there's so much, right? I mean, you just think about all of the different reports that you pick up and how different nuances between individuals and between incidents, which we like to call exceptions. There was just really difficult to figure out which of this data that we needed to keep right available. And so when we really needed to kind of drill down on it, we spent a lot of time sifting through data so that we could actually pull information together so that we could actually evaluate it. So the end result for that at our beginning point is that we had data that helped explain why something happened, right? You could go back and say, okay, now that I looked at the data and we've had time to kind of go through it, I understand now what happened and how we ended up there. But the feedback, the planning, and the outcomes that we were getting to, honestly, they were just coming too late because it took us a little while to get to that data. And so we had some really good analysis, and it just wasn't getting implemented soon enough to make the impact that we wanted. So we evaluated and said, okay, what do we need? So the next slide, we'll just kind of talk through. This is going to sound like pie in the sky, but really what we needed is we needed to see all the data all the time. That's really what we needed to be able to look at, is because you really needed to be able to kind of drill down on it. If we were going to analyze things efficiently, we needed to have ready access to things. And we needed a system that could work for us, that could do some of the initial analysis, that could actually highlight something that says, hey, you need to take a look at this. We really needed for our analysts to spend time solving problems, not sorting through paper. We started where a lot of folks start, and then we had spreadsheets, we had paper, we had Word documents for reports. We just had things spread in a lot of different locations. And so trying to bring all that together was difficult. We wanted to have data prevent exceptions, not just explain them. And we weren't there at the beginning. And of course, once we had data, then what we wanted to be able to do is provide timely feedback for folks. We wanted to be able to give, some progress and accountability. So you say, okay, we've highlighted something for you. Now what we need to do is to make sure that we're actually working on that and making sure that we could track the progress. And I'm an executive director, and so it was really kind of important to me that we also be cost effective, right? When we first started looking at this, it was easy to say, well, we just need a couple more quality analysts, and so they could, somebody to sift data, somebody to make solutions, those kinds of things. And it's just like we needed to figure out a way to be more cost effective than that. So what we ended up with. And what we did is we created a system called IRIS, which is Incident Report Information System. And honestly, IRIS it shows that we're on a journey, right? Because we really began with incident reporting, and then we started adding our own stuff to that, and we started adding other things to it. So it really is a central quality assurance hub for us, but the name doesn't quite reflect that. So just want to make sure you keep that in mind. But it does maintains all of our service exception data. We also have our Palm data in there. We have satisfaction survey data in there. We have implemented some rudimentary AI that'll actually trigger alerts to help identify trends. And it offers the ability to kind of drill down from trend data into specific information so that what you can do is so that the analyst and the QA team can actually spend time really looking at things and say, okay, what's the problem and how do we solve it? So I'm just going to walk you through quickly what that looks like. So I love Elizabeth's point about a dashboard, and because for us, this is the top part of our dashboard, but I just want to point out a couple of things here. One is that every item on this page is clickable. And what it does is it allows you to kind of drill down from the graph. Okay, if you look at one of those points on a graph, it kind of drills down to here's the exceptions that go under that point. And then you can go from those exceptions to actually look at all the data within that particular report. So we've tried to automate all how the data gets into the system. So like for incident report, those things will actually just load automatically because they come on a standard form, and we just email it, and then it actually loads it into the system for us. So up at the top, you'll see that there's a couple of dates, and what will happen is you can change the dates. Right now, it just comes. We did this in May, so it just goes back for a set of 6 months, but you can set any date range, and then it'll reconfigure the dashboard. So if you're wanting to compare, different periods of time, if you implemented something and you want to see whether or not it is working, you can say what did it look like before, what did it look like after, those kinds of things. So the bottom part of the dashboard is on the next page, and so what's happening is on the top graph, if you want to look at we showed medical services up there, you can actually say, okay, well, show me what's all within medical services. One of the things that we spend some time looking at is emergency room visits, because emergency room visits are an exception. You don't expect those things to happen. And so I want to try to take a look at that. If you click on that pie of the emergency room visits, the next slide will show you what you get. Which is basically just a listing. Okay, here are all the exception reports that show about emergency rooms. So you can get a sense that there's 21 exceptions. If I go to the next slide, then what I did in this one is I just did two things. I clicked on back one more. Yeah, I just clicked on the sort, so it's sorted by the individual. And then I clicked on those little carrots that drop down. So what it showed when I sorted it is I had 15 different people that made up those 21 reports. And then I can look for that top individual. I can just drop those down, and it'll show me a summary of what happened with those. So then immediately what could happen is the QA staff can kind of look and say, okay, what's going on with this particular individual? What's going on? If you want to see the full report, which kind of shows you what's going on, you just click on that number. It'll take you to the next page. I'm going to go back to the dashboard. And then there's a few things I want to kind of highlight here. One is at the top, there's Three things I want to point out. One that says client flags, and we'll look at that next. But then there's one that talks about open QIPs. QIP is a quality improvement plan. We actually have two different types of plans. One's a quality improvement plan, one is a remediation plan. Quality improvement for more something that is agency-wide, and then the other plan is about having somebody who they have an issue individually, and what we're trying to do is have a remediation to try to work on that. The next thing is it says responses due. That's over the side. That will tell you, it will alert you that, hey, you've got something that needs you to pay some attention to. So the next page is that's actually what you see when you look at the client flags. What it's going to do is it's actually going to go in and say, we've set up thresholds like within 30 days, 60 days, 90 days, just trying to say, hey, you know, or in a particular service category, there's something that we want to know. So the system's going to go through and kind of look at all that information and then flag those for the quality team to look at. And Tom will talk a little bit more about that later. I'm going to go back to the bottom section. The next slide is the bottom section of the dashboard, and just highlight a couple of things. And that is that the Palm data is there. And so what that's showing you is that within, is it occurring, or are the supports in place in any one of the 21 inquiries, that what you're able to do is kind of click and see what actually kind of you are getting in terms of the Palm interviews. So if you go to the next slide, this is a slide that'll show you, if I clicked on for this one, do people participate in the life of the community? Kind of shows you from our Palm data of the interviews we've done, you know, what, you know, how does it rate in terms of, is it there, is it not there? And then if there are any comments, then you can kind of see, again, if you want to see more information on the actual Palm interview, you can click into one of those and actually get to the data. We also do, the next slide is, we also do the same type of process with our satisfaction surveys. So those are loaded into the system as well. Unfortunately, we don't have those. We're still evolving. They're not quite on the dashboard yet, but we're going to get them there. So the next piece I'm talk just quickly about is the quality improvement plan. So that's the next slide. And so this, had we gone back to the dashboard and I clicked on the 10 plans, this is what's going to come up. And I dropped a few of those down so you can kind of see that it does give a brief summary of what those are. Specifically, one that we're working a lot on is facilitating natural supports. If you go to the next slide, that's actually a little more of a report of that. So the way the system works is we've gotten really comfortable working with this on the computer. But a lot of the work that we do isn't done on the computer. It's actually in meetings, it's talking with folks, it's in people's homes, those types of things. And so when we have a quality improvement plan or a remediation plan, the system can kick that plan out. And this is an illustration of that. So this is a plan report. There's several pages, so that's why it looks a little cumbersome there. But it can be printed out, and then you can actually have a meeting, can talk about, here's where we are, what are we doing next. If it's a remediation plan and the team needs to sign off, that's part of the paperwork. That comes back and then can get entered in. So again, the system will keep track of that, make sure that things are moving along. And then it will also, when you set, okay, this is when we need to follow up on you, it will remind you that indeed these things need to get done. So that's what the response dates will do. So lastly, the next slide is to look at this. The system also generates and it's not self-generated. This is done by one of our quality analysts, and they do a monthly QA report that comes out of the system, but it pulls most of the information. And then what Kimberly gets to do is she goes in and actually adds some narrative about, okay, this is how we are seeing these trends, or this is what's happening with this, or this is what this is what we need to do as a team organization, and making folks aware. We distribute that report to our administrative staff as well as all of our regional directors, and so that that information gets out to them in the hands of the folks who can actually do something with that information to make people's lives better. I would say this, I've said at the end of the part when we were kind of figuring out what we wanted, that it needed to be cost effective. And what we looked at, this system roughly costs us about what it would cost about 10% of an analyst's time. And I would say that in terms of the functionality and stuff that it does for us, that we actually have gained more than that back in terms of being able to have staff that can focus in on trying to make solutions happen rather than just trying to sift through data. So I'll shut up and I'll turn things over to Tom and he can tell you how it really works.
Thanks, Rick. Now that you have a sense of the system, we thought we'd highlight the process, and then I'll give you a couple of practical examples to maybe flesh it out a little better still. So we sort of engage in a 5-step process. The technology that Rick just described to you is terrific. It puts so much information at our fingertips immediately. It is highly efficient. But data is just data. And I'm a big believer that it's our QA team and the human analysis component that's really the key. At CVL, we take a lot of pride in knowing the people that we serve well. And that starts with DSPs and service teams and regional teams. But in QA, we really feel like this gives us an opportunity to know people well in a different way. Sometimes even than the people on the ground might not know them, just because it's hard to keep track of all that's going on sometimes, and we're able to help with that. So let me just walk through these 5 steps. The first is data, and Rick did a nice job. If you want to move to the next slide, Rick did a nice job of describing what we collect, from service exceptions to incident reports. We love having our POM interviews in there. And I'm going to give an example that shows sort of how we drew from that data. Satisfactions are there. Complaints and suggestions is actually the area we're right now working on incorporating into the system and into the dashboard so that we can track those things, not just that we receive them, but then also how do we follow up and how do we close the loop so that we make sure we're responding to people and communicating well. The data is really great, but it needs to be put in the form of information that's useful to us. And so the next slide shows that the system really provides that first level of transformation, maybe. I don't know if it's analysis, but it transforms the raw data into information that we can actually use in our QA meetings. So the system will flag individuals, as Rick pointed out, that meet predetermined thresholds that really we just set based on experience and what we've learned over time, that we want to know when somebody's having a medication error every week, or multiple ER visits beyond a certain threshold, because it just signals that we might want to take a closer look. The QA reviews are another important source of information. Nobody else really has this global kind of awareness and perspective on the organization and the services we provide. So putting those in a form that other people can digest as well is important. The aggregated data is such a great place to start, because we have our fingers in the system, our eyes on things so much. We can really, from what we see, because we're paying attention over time, we can identify trends. Even if the system doesn't overtly express them that way, we can see things as they're changing in real time. So once we have data transformed into information that's useful, to me, the crucial piece is what insights can we gain from that? And so in my mind, data is really just the beginning of our understanding. So our typical approach, actually it happened this morning, our QA team meets at our regular time is Tuesdays at 10 a.m. We go through all the client flags. We look through the quality improvement plans and the remediation plans, make sure we're making progress on those. Those being incorporated into the system really serve as a kind of project management tool. It's been a really nice way not to put something on the back burner and forget about it, or have it drop off your radar screen when you've identified it as important, because sometimes urgent needs take over. So um, the data is the beginning, but then what we do with that is we do a lot of team follow-up. We acknowledge that data is just one piece of the puzzle that we're trying to understand. And so we'll communicate a lot directly with the people that are actually providing supports and know those individuals well. Insight also comes in the form of our QA reporting. We can, like I said earlier, we can highlight things for folks that people may not be aware of, or they don't realize the scale or the magnitude of an issue that's happening across the agency or with an individual. So that kind of analysis, that kind of getting the rest of the picture from the rest of the team lets us develop insights that move us into action. And I'll just say, we really grind over the data and we discuss individuals at length. And one of the best parts of this system in terms of generating insights is in real time, we can develop historic profiles. We can look at just sheer numbers of, for instance, incident reports, or has it changed from last year to this year? Has it changed in the last quarter versus the previous, 2 quarters? We can kind of mix and match and shuffle and dig deeper, and it really provides us with much more focus when we go into the action phase. So that in terms of action, one of the things I've learned in this role over the years is how important communicating our work is to the rest of the agency and to service teams. So our monthly reporting, Rick said and showed you, it goes out every month. There's a summary. At admin meetings, we'll highlight issues, we'll highlight trends. We'll identify as a group then, training needs for our staff. We also communicate at all staff meetings. Again, we do a lot of team consultations and communicating back and forth. And then really an important one that we've incorporated in the last several years is we developed an advisory committee, and it's got stakeholders representing individuals we support, parents of individuals that we support, and interested and invested community members, as well as some staff. And so when we're coming up with our analysis and trying to gain insights and trying to think about what we want to do with all this information, that diverse group has been really invaluable in providing feedback and suggestions that come from kind of all aspects of people involved with what we do. And then, as Rick mentioned, action also then results in the development of quality improvement plans. If it's an organizational issue, or if it's more of an individual focus, we call those remediation plans. And then we look, the last part of our process is trying to assess the impact. It's not enough to look at all this and do something good and hope it worked. So we do a lot of pre and post comparative results. We can do that in the system. This is an unpaid endorsement, but we find Palm interview data really helpful in terms of trying to determine whether what we're focused on and what we're implementing and doing is helping people get to where they want to be by their own definition. And so we find that so useful. So let me give you a couple of examples to maybe put a little more, I don't know, polish on this. So the first one, Rick showed you a QIP on facilitating natural supports. And the data that we kind of started with on that one was, in fact, Palm interview data, where, we noticed that there's a consistent area of need among much of the population we serve in terms of relationship development and ongoing natural support development. And we also determined, it was pretty obvious from our bar graph that you saw earlier, that our current supports just weren't sufficient because it wasn't improving. We weren't moving the needle. so that it started with the Palm data. We also looked at service satisfaction surveys, and we talked to staff about what they were needing and wanting for their work. So based on that data and the information that we weren't doing a good enough job, frankly, the insights that we really focused on were that participating, it sounds simple to say now, but participating in relationships requires a certain set of life skills that our folks were sometimes struggling to acquire. And the other insight we developed was that service visits, and I say this a lot around here, what you do on a particular Wednesday, we always have to be thinking about how that's connected to a longer term goal for a person. We don't want people just filling shifts and ticking off hours. So for the action piece, we developed a QIP. Rick showed you that one earlier. And we really focused on two areas. One was training development to help our people understand both where the folks they support are in their lives, in their development, but also where we're trying to get them. And we really have increased the sort of the coherence of the training we supply throughout the year. And we had previously relied on a lot of outside presenters, which has been great because they're experts and they bring great content, but we really have pumped up our in-house training capacity, which means we feel like we can get all of our staff up to a common level of understanding that helps us create the culture we want and provide the service we want. And in fact, part of this QIP ended up we added a director of training position in the last year. So that's a pretty tangible result. The other thing we did was work on some tools to provide with staff for use out in the community with the individuals they support, one of which is a life skills flashcard, we call it. On one side, it has a list of prompts for how do you have a conversation around something like relationship skills or communication or refusal skills. And you flip the card over, and on the back, it will give action steps. So it'll give 3, 4, 5 very specific things you could do when you're supporting an individual in the community to help them develop those skills. So we're trying to sort of bridge that gap. So the impact of this particular QIP is that we have that new in-house training initiative. It actually started its pilot last Wednesday, so we're very excited. That's happening right now. Like I said, a more strategic and cohesive annual calendar of training is now in place. And we think we're still assessing this, frankly, but we think we've improved the linkage between weekly activities supported by our staff and the long-term goals of the individual. So I like that we have that intentional focus on developing skills among the folks we serve. Let me give you one more quick example. I'll try and be quicker. The individual example. So this started with data that came to us through the system, through the client, what's called client flags, the service exceptions. We had an individual who seemed to have a spike in the number of seizures she was having and the fact that they were resulting more often in falls and injuries. But one of the things we've learned over time is we have to check our own assumptions, because sometimes you think that you've got a bead on something. You think, oh my gosh, this IR that just came through, that's been happening a lot lately. And we'll go check the data. It's like, no, actually, it's about how often that kind of thing's been happening for that individual for 2 years. And sometimes it happens the other way. You think that everything's fine, and when you look at the numbers, oh my gosh, we're missing something. So those flags really help us know where to direct our attention initially. And then, of course, we did some team consultation. The information that we drew from this data was that there really was a trend. In real time, we could identify that this person, their level of risk and potential for harm had escalated quite a bit in a matter of months. So the information we started pulling from that was we started tracking those trends and being able to look at them in real time. The insights were that we acknowledged she had a consistent higher level of risk ongoing, and that there were multiple negative downstream effects that were resulting from that. and her overall quality of life was quite diminished. So this resulted in the remediation plan. We were able to equip the service team with real-time data updates, sometimes more than even once a week as incidents came in, and we logged them and added them to the tracking sheet. We also then partnered with the team and ended up consulting with them, but then going and meeting with the family with them was part of our action. The impact is that the family ended up being supported to face some really difficult decisions with accurate information. Even they sometimes could lose perspective on how much some negative things were happening and whether it was escalating or not. So we could make them aware of those kind of changes. We gave them a reality-based perspective as a backdrop for their decision making. So that seemed like a pretty important role for us to play. And we continue to do that. In fact, they took a copy of the tracking sheet for their next consultation with her physician. So I hope those are helpful to just make, I don't know, a little more practical sense out of all that technical stuff and the technology. There's always next steps for us. So like I said, we're trying to work on suggestion and complaint data to get that into Iris. I'm also responsible for doing all the internal investigations in the agency. So we'd like to incorporate that. Elizabeth mentioned the rights data, adding that to Iris. We do a good job of tracking rep pay e-reviews and Human Rights Committee reviews, but we haven't incorporated it in the system. And if we could, we think we'd benefit from that. For example, better alignment of our data. We'd like to track it better to the basic assurances as a way to examine outcomes. And as a developmentalist, I'd love to see us find better ways to analyze the data by life domains. And hopefully with the advent of what's happening with AI, we can use some of that for good and basically carve out even more time for us to do the work of making sure we know our people and less work dealing with just pieces of data that haven't been made meaningful yet. All right. So, Rick?
Thanks, Tom. I guess one last thing I'd like to say is our contact information is here, as Tom mentioned, right? We're always looking to improve these things and always looking to be better. And so, look, if you have questions, we're glad to answer any of those questions. But also if you see things like, oh, you know what, that they might benefit from this, or suggestions, ideas, resources that you have, we'd love to hear about them. So feel free to reach out. We are a not-for-profit, so if there's anything we have that we think we can share and help, we'd be glad to do that too. But yeah, just wanted to pass on our contact information. So appreciate the opportunity.
Thank you, Rick. And thank you, Tom. That was fantastic. Love hearing from our partners. Just a few other additional resources. Of course, I'm going to encourage everyone, if you have questions about anything that Rick and Tom talked about, or the system that they use and how they use it, like Rick said, reach out to them. Just a few other quick things that are on here. And Seth had said at the beginning of the webinar that the slides will be ready in 2 to 3 weeks. So you'll have these in front of you, but just some books, some websites that you could check out when it comes to putting data into action. Of course, sign up for CQL emails, because we have resources that'll go straight to your inbox, and we have a lot of them and we love to share them. And then also, we always recommend that you connect with us through our different platforms: Facebook, Twitter, or X, my apologies, YouTube, LinkedIn. And then, of course, our e-community on Facebook is fantastic, where you can connect with other CQL accredited partners and get some ideas on how other organizations are doing things. So again, I'm Elizabeth Seitz, Director of Organizational Excellence, and my contact information is here if you have any questions for me. But I think we'll pass it over to Seth to see what we might have in the Q&A.
Thank you all. And like Elizabeth had said, just a lot of really good information from Community Ventures and Living. We have a handful of questions, Rick and Tom, for you. And there's a lot of questions that are kind of similar, and one of them relates to Iris and your data system. Where did you get it? Is it available for purchase? Who is the developer of it? All of that type of information.
I should probably unmute before I answer that question. So, that requires a little bit of story, and that is actually we developed this system, but we developed in concert with a software developer. I had taken a little sabbatical and done some software development, so met somebody there, and so it's actually custom made. There are a few other agencies using this now. I think actually people that we just had opportunity to meet and talk about, and so it is available. We typically don't sell things because we're not for profit, but and really the person who manages it now, folks can use it. They just need to pay for the technology side of things. So that's how it works. It is web-based, and so it's and centralized at a data system, at a data center rather. So hopefully that helps.
Definitely. And would, since people will probably ask then, would the best kind of next step then be to email you both if they're interested in talking further about that?
That'd be great. And probably what would be helpful is just because the system could do a lot more than you can put in just a few slides, right? So, and so there are a lot of other features like in terms of getting data in, it reading stuff in, tying to the web. So if you do satisfaction surveys online, it'll actually pull that data in, those types of things. So yeah, if somebody's interested in, they just want to see, then what we can do is set up a time just to kind of run through it. Be glad to do it, you know, and then we just connect you with Steve, who's the person who kind of manages that. So
excellent, very helpful. So for our attendees, please check the Q&A box. Their emails are included in these. They'll also be in the PDF version of the PowerPoint slide deck that we'll send out in roughly 2 to 3 weeks. Another question was for CDL, what is the composition of your QA team? Who sits on it?
I'm happy to answer that. I'm sorry I'm not visible right now, but it says my video's been stopped by the host, so I'll just assume that's how you wanted it.
Sorry about that. My apologies. That was my fault. Sorry about that.
Oh, it's all good. So right now there's myself as director of quality. I have a full-time quality analyst named Ian, and then another part-time quality analyst who works down in our Indianapolis region as a direct support provider and a community support coordinator, but she also does some QA with us. So it's just the three of us. It's a small little group, but like I said, maybe that's partly why I feel like in some ways we're effective, because we just huddle up every week and talk about individuals and really try and make sure we're not missing anything. So I really appreciate her direct support experience. And then Ian, he's always been our quality analyst. He's just grown so much in the role. It's a tight, good team.
Tom, one thing I'd add to that is also Ian does a number of the Palm interviews as well. So part of the QA process is for the analyst to do the Palm interviews. So.
Right.
Well, thank you both for sharing so much great information. Elizabeth, thanks for your presentation at the beginning. So with that, I'd like to thank our presenters from Community Ventures and Living, as well as Elizabeth Seitz. So we really appreciate it. And thank you for all the attendees for joining us today.
Thanks, everyone. Thanks,
Thank
Rick and Tom.
you.
Thank you.
All right.
Thank you.
Thank you.